Cancer has presented a tremendous challenge to the medical profession, and the University of Kentucky is responding. UK researchers are taking several different approaches. They're studying the body's immune system and why its ability or inability to fight off infections seems to be important in the development of cancer. Research groups at UK are also looking into the possibility that hereditary factors may be involved in some forms of cancer. Information gathered is then used in the development of new therapies and drugs. As an example, the University of Kentucky is the home of the largest comprehensive bone marrow transplant unit in this region of the country. The transplanting of bone marrow has been a relatively successful means of treating certain kinds of leukemia. Research is now focusing on how transplants may be made between persons not closely related. Cancer research must take different approaches because evidence has shown that cancer is actually a family of diseases with different traits depending on where it attacks.
Therapies that work for some kinds of cancer don't work at all for others. If we take the most successful treatments of cancer, and those have been in the leukemias, and cancer of the prostate and testicular cancer, these are very successfully treated now with very high cure rates. Cancer of the colon and cancer of the lung, we don't know how to treat, and our cure rates are not very good. So there's something about those diseases that we simply don't yet understand, and that's one of the reasons why this basic research is very necessary.
The McDowell Cancer Network, an organization affiliated with the University of Kentucky, helps cancer patients and their families learn how to deal with the disease. The network has established a statewide Cancer Hope Line, which provides information and support for cancer patients. The organization is also dedicated to helping patients obtain quality care close to home and improving cancer research.
The McDowell Network, then, has two essential components. One is a broad community-based program. The other draws on the resources of the University of Kentucky, particularly its medical center, the College of Medicine, and the other colleges involved to do cancer research both in laboratories and in a clinical center.
The laboratory and the clinical center will be brought together on the UK campus with the completion of the Lucille Parker Markey Cancer Center. The buildings will house both laboratory and patient care facilities.
It will provide us a place in which we can apply the latest techniques in cancer care, but particularly it will give us an opportunity to transfer research information from the laboratory bench to the patient bedside.
Both Dr. Friedel and Dr. Coleman say widespread community involvement was a key factor in making the Cancer Center a reality. The Lucille Parker Markey Cancer Center is scheduled to open in the spring of 1985. The Dorothy Enslow Combs Cancer Research Building is tentatively scheduled to open in 1987. The two structures will be connected, says Dr. Friedel, to emphasize interaction between laboratory scientists and physicians who care for patients. The construction of the facility has added to an already optimistic atmosphere among researchers.
I think many of us believe that within the next 5 to 10 years we will understand why cancer occurs. The big question then will be, can we intervene and can we stop these processes that cause cancer? Everybody's excited, and I'm optimistic.
The University of Kentucky, where some of our greatest victories are in research.